Good morning, America. Today is November 3rd. Today is an exciting day for all Americans, irrespective of whatever happens, the outcomes are. I believe Americans will choose the right thing. No matter what happens, Americans always wins. Americans believe in freedom. They believe in free enterprise. They believe the fundamentals are Americans will expedite that day towards healthcare to be free. They can choose their doctor, they can choose their plan, they can choose their hospital, they can choose their providers, they can choose. They have to be in the driver's seat. What I see here, irrespective of the results, Americans will speed up that day where we will have a total freedom in healthcare. I'll explain to you how this will happen, because the way I see it, the cost of the healthcare is so critical. So far, the America has been wasting the money in the wrong direction. Instead of empowering the consumers, they're empowering the middlemen, where it is not getting the results. Only consumers will lower the cost. I believe in consumers. I believe the cost will be lowered. I'll tell you how it can be done. 160 million blue-collar workers. They already have employer subsidized plans. They receive their insurance from the employers. Employers have to have a wide option. They should offer all the employees health disclosure, healthy pricing accounts, so-called HDHP. I renamed it. And they can take advantage of Health Solutions Advantage, where whatever the money they're saving by participating health disclosure, healthy pricing, the money saved from that is put aside into Health Solutions Advantage account, HSA account. If employer on an average pays $16,000 to $18,000 for an average income of 50 to 55, blue collar income for blue collar workers. If employer is paying every year, I just calculated the numbers, folks. 160 million by 16,000. It came to almost like $2.88 trillion. Every year, employers are pumping the money into the insurance, where employees are not getting the benefit. What I see is they need to offer this. The traditional insurance days are numbered. It needs to go away. They need to offer traditional insurance, compare it to the health disclosure, healthy pricing accounts. They need to compare it. Once the premiums are lower, because their deductibles, there is a whatever, therefore we can determine $1,500. First year employer has to bear that responsibility, but second year onwards, employee takes that responsibility of deductible portion, and the employer puts money aside into either health reimburse accounts or health savings accounts. Ultimately, the employee needs to have a control. It is their revenue. It is a part of their income. So what I would do is, even employers will not have any problem putting that money aside into the employees, because they will be loyal employees to the company, and they'll be good for the company by offering them Health Solutions Advantage, which is HSA. They can put 300, 400, whatever it is, money saved from the lower premium aside. The next one, government subsidized. government subsidized, which is almost Medicare, TRICARE, veterans, federal employee. They're all government subsidized programs. Even the government subsidized programs, they need to offer choices to participate, healthy disclosure, healthy pricing accounts. Give them 5 choices. Give them the choices where they can put money aside into the health solutions advantage. By providing them the choices, each employee, it doesn't matter, city employee, county employee, federal employee, veterans, Medicare, instead of putting the money into the mid-level companies, I would rather give the choice to the Americans to choose out of the 5 health plans, healthy disclosure health plans, to choose where they can put maximum money aside into the health solutions advantage, which is HSA. So that money will be set aside and employees will control that. So they can withdraw the money, they cannot withdraw the money. That is only for the health expenses. They cannot use it for any private, they cannot use those funds for any private use. So what will happen is, you're talking about 240 million people are already covered under employer and government subsidized programs. Another 40 to 60 million small businesses. What I'm saying is, small businesses, you can empower even the small businesses by giving them the same choices what you're offering the government subsidy. Have the small businesses choose, with the participation of the employees, to choose 5 or 10 plans, healthy disclosure, healthy pricing accounts, HDHP accounts. So where premiums are lower, if a person is healthy and the money is put aside into health solutions advantage, which is an HSA, and that is the money that is used for the future health. So you already have 300 million people. So 10 to 20 million illegal Americans who are in this country. There are ways to come up with a solution. They can offer the same thing. They can be, if they are working class, they should be offered the same provisions. So everyone is supposed to have a coverage, health coverage. So-called, we have been hearing this about ACA, affordable. ACA is actually it's a misnomer. It's not an affordable care advantage. ACA is a misnomer. It doesn't give you the options to choose. It doesn't give you, the premiums are not affordable. It is just not practical. What I see is, give them the options, give people the options of participation. Don't put the money into the mid-level agencies and waste the money, because anytime you give the funds to the mid-level agency and get away with billing, this billing, there are 9,000 billing companies, folks. Do we really need all that? I think basically what the government has to do is slowly, the billing needs to be taped off. Ultimately, it has to be through a health solutions advantage for all Americans to have HSA accounts. So that can be used for health. So this way, everybody is covered. They have a choice. They have a freedom to choose the plan, freedom to choose the hospital, choose the doctor, choose the entities, what they need, choose the drugs. They will have more options. And there are ways to provide and get their premiums lower. There are a lot of ways to bring their premiums lower. What I see is, insurance in this is insurance in general. Insurance companies in general, they pool the funds, they share, the risks are shared across the board. This is where I differ. The health insurance, we need to have it reformed. Health care is what a person receives. Health insurance is the financing part of it, pays for it. Insurance pays for it. This is where we need to focus our attention, is on financing part of it. Healthcare, when people receive it, they have to have a choice. There's no doubt. Americans will not sacrifice on choice. They want to have a freedom in healthcare. They want to have a total freedom in healthcare. How do you do it? Folks, when you share the risk across the broad spectrum, everybody is paying for everybody. That is the in principle. We have several actuarials, especially Ron Bachman. He has been in actuarial for 50 years. He has been in front of the Congress. He has been in front of he has worked with the Democrats, Republicans, you name it. He has come up with the solutions. It's called risk segmentation. There is a way to do it, folks. I don't have to pay for somebody else chronic illness. I don't have to pay for somebody else's risk. I don't have to pay. Nobody has to pay for somebody else's health. It needs to be segmented accordingly. So when I say segmented, how do you segment your pool, risk pool, insurance pool? Instead of having a common pool, once you segment it, okay, 63% of the Americans are healthy. Why should they share the burden of everyone else? Their premiums could be a lot lower because they're healthy. And most of these blue-collar workers are healthy. They have private insurance. Why would you want to disturb anything but give them the tools for them to have health solutions advantage and lower the premium by healthy price, health disclosure, healthy pricing? Even in one of the family members, if it's impaired or disabled, we can get the certificate of guaranteed coverage and lower the premium by segmenting people who are impaired or handicapped. What you're doing is you're not spreading the risk among the broad entity. So if in a family member is impaired, or they should get a guaranteed coverage by the government, where that certificate will provide, the insurance companies will love to take care of the impaired members. So 63% of the Americans have less than 1% of the claims. So their premium should be a lot lower, folks. It's a common sense. I don't know why we keep sharing the risk pool with everyone else. The next category is catastrophic. Let's talk about chronic illness. That's a major part. The well category is 63%. Chronic illnesses among the population, you're talking about 16% of the population have chronic illnesses: hypertension, diabetes, congestive heart failure, chronic renal failure, you name it. They have this chronic diabetes. So what it is, that 16% of them file 41% of the claims. This is where government and everybody can come up with innovative method. People with chronic illnesses, we can lower their premium by education, telehealth, telemedicine, technology. Come on, let's do the technology. We can take the maximum advantage. As a matter of fact, what I was told, for diabetics, they should be covered fully even before the deductible has to kick in. So that is a good thing, especially for diabetics. But people with hypertension, heart failure, They all need to be covered. Their deductible portion, we have to come up with, the technology will solve that. They're filing 41% of the, that's a major part of the rise in healthcare cost. That's where we need to address. Then third category, which is, you're talking, we have already addressed almost 80% of the Americans. The rest of the another 16% is at risk. Smokers, at risk employees, at risk anything to, they're 16% of them are at risk. There are several illnesses. You can give them, again, this needs drug addiction is one of them, at risk. Drug addiction, not taking, obesity is one of them. That can be addressed as an at-risk pool by giving them the education. If they participate in their education programs, give them the lower premiums, incentivize them to lower their premium, so that way they can take care of their own health. This is what you need. You need to educate the public. This 16% of this, so you're already there at 96%, folks. You're talking about 16% of the at-risk pool file 20% of the claims. So if you're really looking at the, almost we have covered 96% of the population. We have covered 92% of the claims, which is really remarkable, the way I see it. So finally, the catastrophic, those are the people, they have to have a catastrophic, accidents, pilots, people, you'll never know these injuries, catastrophic ailments. Their claims are very small. Again, they need to be covered. Catastrophic illness need, but that should not raise everybody's premium. It all depends on who's exposed to the catastrophic, and their premiums can be lowered by sharing across the broad spectrum, and that can be lowered. So this is what, one thing the ACA has done good for all of us. I commend for bringing up these issues, because we have been discrediting the ACA. ACA has done one good thing for us. You may ask what? Yes, the ACA, Affordable Care Act, it provides a guaranteed health coverage. This is where the beauty comes in. We need to embrace guaranteed health coverage for all Americans. Folks, this is an asset. This is my home. This is my auto. I need to have insurance. It's a common sense. When you have an asset, you need to be covered. So everybody needs to be covered. Guaranteed coverage. These are the four fundamentals which AC has brought up, and we need to embrace all of them. So guaranteed health coverage to all Americans, irrespective. So if you have an ID, if you have a social security, you have to have a guaranteed. Okay, even in the guaranteed coverage, once you go through the underwriters, whenever you go through you don't have to go through the underwriters again. Right now, that's not what's happening. Once you're covered for the rest of your life, because you have a history. If you have an auto, if you have a home, you have a history of claims and all that. So basically, that history will determine your coverage for a future. Number two, covering the pre-existing illness. It's not even a question, folks. It is automatically covered. Even the president has said, I will not sign anything if you don't have pre-existing clause in the health coverage. I think we can all agree on that. We need to have pre-existing. Insurance companies have realized ultimately that they need to cover because once you have a guaranteed coverage, the pre-existing doesn't even come into it's not even a factor, because it's already there. And number three, transition 26 from the parental to the independent coverage. They can have the coverage from the parents up to 26, which we all agree on that, which I don't see an issue between Democrats or Republicans. And number four, we need to have unlimited lifetime maximum. Unlimited lifetime maximum. Again, it all boils down to how we regulate the healthcare industry. When they send me a bill after a 23-hour stay for an angioplasty, send me a bill for $227,000 for an angioplasty, 23 hours stay. It just doesn't make sense. Since then, I seriously thought about it. This is not happening to me. If it's happening to me, can you imagine average folks with healthcare bills piling up? That's why the bankruptcies are high. That's one of the reasons. We need to get rid of the surprise medical billing. We need to remove the billing as it is. It needs to be paid upfront. As we receive the care, this is where Health Solutions Advantage will come into the picture, folks. Health Solutions Advantage, where they cannot use those funds for anything. It's like having a Social Security. You cannot use it. It's only for healthcare. But that is yours. It is like a 401k. Ultimately, we can even give it to your loved ones once you pass away. So that is yours to keep. We should talk more about Health Solutions Advantage, how we can change it. And number five, last but not least, is comprehensive major medical coverage. It is, again, the reason we are getting insurance. You need to have a comprehensive coverage for unforeseen things like surgeries, emergency, elective surgeries. You need to have a major medical coverage. Finally, what I see is health care needs to be re-regulated. I see a lot of physicians are choked, doctors are choked with all these regulations. Healthcare professionals in general and healthcare facilities, especially hospitals, are under tremendous pressure to perform, to have all these rules and I understand, for the safety, but how much could it be when you have a food industry being deregulated? How much could it be? How much you want to regulate the healthcare? Come on, there has got to be a solution. We need to do it like what we did to the airlines, folks. Airlines, Ronald Reagan did an amazing job by deregulating the airlines. The next day, I remember the day when the airline ticket dropped from $800 to $50. This is what happened when you deregulate the airlines. Same thing, healthcare, when you deregulate it, and you need to have oversight. Don't take me wrong. American, what I see, I believe in our democracy. I believe we have the right mindset to have healthcare consumerism and healthcare freedom. We cannot give up on the healthcare freedom, folks. This is like anything else. We need to have that freedom. We need to choose our own doctor. We need to choose our own plan, man. We have to choose our own entity, hospitals, hubs, you name it. And let them compete. I want them to compete for every dollar. I want providers, facilities, everybody to compete and get rid of this middleman. Come on. Let's not put the money on the wrong side. For a Medicare recipient, don't give them the money. Give them the options. 5 or 10 plans. I have noticed, because I've been in the healthcare for so long, I'm telling you, there's an insurance called SCAN. It used to be for the Medicaid and Medi-Cal. I live in the desert, okay? SCAN, it's supposed to be for indigent population, for Medicaid and Medi-Cal. You know what? Now, this is the number one provider in the desert. The Medi-Cal, they take Medi-Medi. Medicare. So they take money from the Medicare, they take the money from the Medicaid, Medi-Cal, from the federal, state, and this is a successful business. But where are the consumers, folks? You're missing the boat. Give that option to the consumers. Let him decide. I have no problem scan in competition. I have no problem with any entity. But let the consumer choose out of 5-10 plans where they can save in the health solutions advantage. That's the bottom line, folks. You need to save. Consumers have to save, and it's their decision to make. Right now, they don't have that power. They have no control on their, they don't have any choice. We need to have some type of a reform in insurance to have the access. All the government, AARP, if you're listening, you need to embrace this, man. You have to embrace health disclosure, healthy pricing. Give me the 5 options. Don't give me the money if you don't want to give it, but give me the options. With the lower premium, if I save the money, but rest of the money should go into my health savings account. Whatever Medicare is spending, put the money into my account. So I will save. It is not. So that $3.8 trillion, folks, we can use it we can use it in a nice way. I would like to have, in my previous episode, I talked about life insurance for people who are poor. 100,000 guaranteed life insurance. How much does it cost to get 100,000 coverage for 15-20% of the, how much does it, when Prime Minister Modi has given it to 40 to 50 million Indians, guaranteed 100,000 rupees life insurance. We need to do that. We need to have a guaranteed life insurance. The premiums are not much. Government can afford to pay the premiums, and insurance companies will love that. It's helping the insurance industry. It is helping everybody. Let's have people who are in the bottom. They don't have any possessions. We know who are in the poverty line. Give them the insurance. That is the right way to do it. They can climb up the ladder. Give them the tools. Incentivize them to take care of them. People on Medicaid, this is the beauty. People on Medicaid or Medi-Cal, state government, give them the options. 5-10 plans, Medi-Cal plans, whoever the insurance company is, whichever is the lower premium, let them choose it. But when you give them the lower premium, the rest of the money goes into his health solutions advantage, folks, HSAs. It belongs to the consumer. I want you to get to that. It doesn't belong to the state anymore. It belongs to the consumer, because consumer deserves it. Give the power back to the people, folks. Healthcare is so critical. We need freedom, man. We need freedom. Healthcare freedom is so critical. We have freedom everywhere else, but healthcare, it has been a nightmare. It has been a nightmare. Let's do it, folks. Let's do it. Again, I want to end this by saying Abraham Lincoln's quote: "This country can never be invaded from outside." You know why? It's a freedom, folks. Freedom. If we falter on freedom, it will be, because we did it. We deserved it. If we lose on freedom, then we lose it. This is what it is, bottom line. And America will be a shining city, as Ronald Reagan said, all over again. And we will be, I can bet you, before I pass away, America will be a number one healthcare provider, healthcare delivery, not 37, number one in healthcare. People will be coming to America for healthcare across Canada, across the world, because we are cheap. It's affordable. It is transparent. It is competitive. Folks, you can't beat that. Let's join the forces. And if you like this channel, subscribe to this channel. I'm planning to go live one of these days. So this is CCN, Consumer Care Network, and I am consumer's doctor. I'm retired. I work for you through a non-profit entity called Foremost Organization. I'm your servant. I will help anybody who needs an advice, especially in regard to the insurance, in regards to the health. I am your advisor, folks. I am the consumer's doctor. This is Dr. Vingala. Thank you for joining us. We'll see you next time.